my name is Alyssa Ream. I've been a nurse for 9 years. For the past 2 years, I've been working at a community-based mental health program in Milwaukee, Wisconsin. I really love the population that I've been working with here. A lot of the patients do have a schizophrenia diagnosis, so it was really interesting learning about metacognitive therapy as a non-pharmacological intervention for schizophrenia. Schizophrenia is a chronic psychiatric disorder of delusions, hallucinations, and impaired functioning. The annual cost of care for schizophrenia in the United States is higher than all cancer types combined. In 2019, it costed $343.2 billion, which includes things such as homeless shelters, social services, healthcare, caregiving, and law enforcement. Also, 20 to 40% of individuals are medication refractory, so treatment plans should not rely on medication alone and should include interventions like metacognitive therapy. Kolkaba's theory of comfort supports metacognitive therapy on these different areas. For the physical aspect, patients have a lot of muscle tension because of paranoia and anxiety. And MCT works to reduce these negative thinking patterns, which in turn would support physical comfort. For the psychospiritual aspect, MCT as group therapy provides a lot of emotional support through peers and also with the nurse practitioner leading the group. MCT teaches them skills to feel more confident in themselves and find inner harmony. For the environmental aspect, MCT should be done in a quiet and clean room where they can do group in private and feel comfortable. For the sociocultural aspect, MCT done as a group would bring them a sense of belonging because they are among peers and they could grow supportive relationships with each other. There is a free MCT program available online by Moritz. It includes all the materials you would need to get started. It includes a training manual for the provider to learn how to provide MCT and the modules for each of these topics. This slide is from the Jumping to Conclusions module. As you can see, the purpose of this slide is to teach patients to reconsider the meaning they assign to everyday events. Individuals with schizophrenia may experience delusions of reference, in which they believe that ordinary events have a special personal meaning. For example, a patient may hear Britney Spears' song Toxic playing on the radio and interpret it as a secret warning there is going to be a chemical attack about to occur. MCT encourages patients to pause and consider alternative explanations before jumping to conclusions. In this example, a more realistic explanation would be that the song is simply being played because the radio station features pop music. By practicing this skill, patients learn to challenge automatic assumptions and develop more balanced interpretations of everyday situations. Penny conducted a systematic review and meta-analysis of studies published between 2007 and June 3rd of 2021, examining the effectiveness of metacognitive training for individuals with schizophrenia spectrum and related psychotic disorders. Their research included studies that use the original MCT program or acceptable adaptations of the intervention. A total of 43 studies involving 1,816 participants were included in the analysis. The researchers found that MCT produced statistically significant improvements in symptom severity. Specifically, MCT demonstrated a moderate effect on positive symptoms and a moderate to large effect on delusions. These findings suggest that MCT is an effective intervention for reducing psychotic symptoms, particularly delusional thinking in individuals with schizophrenia. Fekete conducted a randomized controlled trial at 2 outpatient sites in Hungary involving 46 patients with schizophrenia. Participants completed MCT in small groups of 4 to 5 individuals, with one module completed each week over a 16-week period. To measure symptom severity, the researchers used the Positive and Negative Syndrome Scale, a standardized tool that assesses positive symptoms, negative symptoms, and general psychopathology in individuals with schizophrenia. The MCT group showed significantly greater improvement in symptoms compared to the control group. Specifically, the MCT group improved by approximately 14 points more on the PANSS than the control group. Acuna conducted a qualitative study involving 10 patients who had completed a 10-week MCT group therapy program. Following the intervention, participants took part in 40-minute semi-structured interviews to share their experiences and perceptions of the program. Overall, patients reported improved self-esteem and valued the peer support that they received through the group therapy format. Participants also described the program as beneficial for understanding and managing their symptoms. Notably, all participants expressed that the MCT program should continue and be expanded so that more individuals with schizophrenia could benefit from it. I created this plan to be used at my current workplace. So step 1, the psychiatric mental health nurse practitioner, psychiatrist, case managers, nurses, and program director would meet to discuss patients that are medication compliant but still moderately symptomatic and cooperative, because these patients would benefit the most from this program. Step 2, the nurse practitioner will use the PANSS to score these identified patients from the meeting. Step 3, the nurse practitioner will discuss attending MCT group therapy with each of these patients and see if they are interested in participating in this program. Step 4, the nurse practitioner will form a schedule for MCT group therapy to start when at least 4 patients have agreed to participate. Step 5, the nurse practitioner will implement MCT modules by Moritz. We will do 1 module each week for 10 weeks. Step 6, the nurse practitioner will use the PANSS to score participants during halfway mark at 5 weeks in the program. Step 7, the nurse practitioner will use PANSS to score participants after the 10th week has been completed. And then step 8, the nurse practitioner will use the PANSS to score participants 4 weeks after completing MCT. This schedule helps illustrate the implementation plan in a little more detail. Our clinic already holds a weekly team meeting, making it a convenient opportunity to discuss the initiation of MCT and monitor its progress. During the first week, the team would identify patients who are appropriate candidates and begin recruitment. Once at least 4 patients are enrolled, a group schedule would be developed that accommodates each participant's availability. To evaluate the effectiveness of the intervention, the PANSS would be administered at multiple time points throughout the program. Scores would be collected during the initial assessment before starting MCT, after completion of the 5th module, after completion of the 10th module, and again 4 weeks after the program concludes. These repeated assessments would allow the team to monitor changes in symptom severity over time and evaluate the short-term effectiveness of the MCT program. And here is my reference list if you're interested in learning more about MCT. Thank you for your time.